I have been hearing a lot about the Affordable Care Act. I do not feel like Congress did a good job in crafting this bill. It's a monstrosity, really, over 2,000 pages, which has really just cemented in place the health care industry that we've had for as long as we can remember, which is basically controlled by our health insurance companies. And health insurance companies are not concerned with creating a healthier population here in the United States. They're concerned with their own profit margins, and their own profit margins are determined by how many people are sick, really. So they aren't concerned with making us healthier. They're just concerned with maintaining the status quo. And this bill has essentially done that. It's done a little bit to mitigate the increase in costs, but a lot of people out there, myself included, have noticed that before the law went into effect, a lot of these health insurance companies jacked up their rates just to make sure that things weren't so bad when it did go into effect. Now, if we'd really wanted to change the system, we would have been talking much more about how we create a healthier population. More than just the doctor's visit or what the hospitals are charging when you go to the emergency room, we need to talk about creating opportunities for healthier lifestyles, active lifestyles with better nutrition. And again, that touches back on our food security issue. It touches back on creating the sustainable transportation infrastructure which encourages walking and biking rather than the sedentary lifestyle of getting in your car and commuting to work for 20 minutes. So that means greater transit. We can't have these health insurance companies, which are exempt from antitrust legislation governing our health care. Right now, that's the system. The health exchanges that were created under this act are not going to change that fact. What we need is really a system which provides something like Medicare for all. And people call that the single payer option or the public option. It was taken off the table before serious conversation was ever started on the health care bill that we now have. And we need to go back to the beginning. We need to make sure that we're providing insurance for everybody, and we need to hold our health insurance industry accountable.
I am willing and able, yes I'm able. I am willing and able.